Emergency Preparedness Part 2 lecture. In this part, we will talk about common office emergencies. The following on this slide are the things we will be covering in this part. Common office emergencies: fainting. Fainting is a transient loss of blood flow to the brain. The first thing you will want to do is check for a pulse on the patient who has fainted. You will then place the patient in a supine position, loosen tight clothing, and apply a cold washcloth to the forehead and the back of the neck. You will then monitor vital signs on that patient. Poisoning occurs by oral intake, absorption, inhalation, or injection. Tell the caller to stay on the line with you while you call the Poison Control Center and relay all directions. Do not induce vomiting unless it is advised and the patient is fully conscious. What to do when a poisoning is reported: ask the patient's name, weight, and age, the name of the poison taken, and any information on the label, how much was taken, how long ago the poison was ingested, whether vomiting has occurred, any pertinent symptoms such as difficulty breathing or an altered state of consciousness, and any first aid that has been given. Animal bites can cause rabies, tetanus, or other infections. It is important to cleanse the site with antimicrobial soap and water as soon as possible. Then check the tetanus immunization record. If the tetanus immunization has not been given within 7 to 10 years, a booster may be needed. Wild and domestic animal bites will be investigated for rabies. Insect bites and stings, usually not serious unless severe allergic reaction occurs. Signs and symptoms: a dry cough, tightening of the throat or chest, swelling, itching around the eyes. Hives, wheezing, dyspnea, and hypotension are symptoms of severe reaction and usually requires epinephrine for severe reactions, or a patient can be given an antihistamine such as Benadryl or Zyrtec for a minor reaction. Asthma attacks characterized by expiratory wheezing, coughing, feeling of tightness in the chest, or dyspnea or shortness of breath. Treatment is really individualized for each patient. They are usually prescribed bronchodilators and should be used at first symptoms. Seizures can be either febrile or grand mal seizures. Febrile is usually when a patient spikes a temperature, they will go into a seizure-like effect. Protect the patient from possible injury and observe until the seizure ends. Do not try and constrain the patient or place anything in the patient's mouth. Once the seizure is over, place the patient in the recovery position. This is the same position as explained for strokes. A lot of times for seizures, we give them Valium to decrease their anxiety and tension. This helps with the recovery process. Abdominal pain, a symptom caused by many problems. It can be either mild or serious. Anybody with long-standing abdominal pain and dark stools or even bright red stools should be seen immediately. Treatment can be to keep the patient warm and quiet. Emesis basins should be available. Administer nothing by mouth. Everything should be administered rectally or IV or IM. Do not apply heat, and administer analgesics as ordered, and then keep track of the vital signs. Sprains and strains. A sprain is a tear in the ligaments, and strain is a tear in the tendon or muscle. It is a damage to soft tissue, blood vessels, and nerves. It is important to elevate the affected area, apply ice and mild compression. After 24 hours, alternate mild heat and ice. Fractures and burns. Fracture is a break or a crack in a bone. Place the patient in a position that supports the affected area at the joint above and below the suspected fracture. Burns caused by flames, heat, scalds, electricity, chemical, or radiation. Chemical burns should be flooded with sterile H2O. It is important when treating a patient with burns to remove the clothing or instruct them to move the clothing if it is a chemical burn first, and then flood the area with water. Burns are typically classified by depth and extent. We use the rule of 9s, which I will show you on the next slide. We must know the cause, the location, the approximate size, depth of burn, and any additional injuries in order to classify them. So the rule of 9s, each body parts are divided into 9. So for an adult, the head and the arms are 9 apiece, and then the front of the torso is 18, and the back of the torso is 18, and then the legs are 18 each. So this is how we calculate the percentage of burn on the body. Infants are a little bit different, as their heads are usually larger compared to other portions of their body, and so there's a little bit different numbering system used with infants. Tissue injury, we have contusions, which is a closed wound, abrasions. I think of skidding along a blacktop after falling off a bike as an abrasion. Lacerations, commonly seen. It's important to cover the injured area with sterile dressing. Sometimes we'll use butterfly closure strips. Microporous tape or tissue adhesive products may be applied to close the less serious lacerations. Punctures or evolutions is important to elevate. If possible, if it's an arm or a leg, it's important to elevate to reduce swelling. Any open wound on a patient that is on anticoagulation, those patients should be seen immediately for risk of long-term bleeding. Nosebleed or epistaxis is a rupture in a small blood vessel in the nose, mild or moderate. Have patients sit up and lean slightly forward, pinching the nose for about 15 minutes to encourage clotting. Medical emergencies if bleeding is bilateral and continuous, or if the patient has bleeding disorder or is on anticoagulation therapy. Head injuries should always be seen the same day. Severity of the head injury can vary greatly. History of the injury is crucial in determining the appropriateness of management. Dizziness, severe headache, mental confusion, memory loss, and loss of consciousness are all symptoms. Vomiting, loss of bladder or bowel control, bleeding from nose, mouth, ears, pupils, unequal or unreactive to light are more serious symptoms. Notify the physician or EMS immediately if this happens. Stabilize neck and do not move if neck injury is suspected. Patients should be kept NPO and watch the pupils and record vital signs regularly. Foreign bodies in the eye, keep the patient from touching the eye. Place in a dark room, a lot of times photophobia is common. Eye irrigation may be ordered by the physician. Heat exhaustion, loosen clothing, hydrate, cool off with wet cloths and fans. Oftentimes patients with heat stroke, which is a more severe form of heat exhaustion, will need IV fluids. Heat stroke is where they're red, hot, dry skin, semi-conscious, very tachycardic, rapid and shallow breathing also occurs. And in real severe cases, they will start vomiting. Injuries to cold. Frostbite is freezing of tissue and can cause necrosis. Immerse in warm water but never rub the area. Hypothermia, medical emergencies when the core body temperature drops below 95 degrees Fahrenheit. Shivering, numbness, apathy, loss of consciousness are common. Remove wet clothing, wrap in blankets, and wrap in blankets and then get into a warm place. Dehydration is when more water is excreted than taken in. Sometimes can happen due to extreme diaphoresis. Is characterized by vertigo, dark yellow urine or no urine, extreme thirst, lethargy, confusion, and cramps. Encourage fluid intake and take to the emergency department if extreme. Diabetic emergencies, hyperglycemia or high blood glucose, hypoglycemia, which is low blood glucose. Sometimes patients can go into an insulin shock if they take too much insulin. We would then provide glucose immediately and preferably glucose tablets. However, if those are not available, any type of candy or fruit high in sugar. Diabetic coma is a serious hyperglycemia, symptoms of impeding coma. Symptoms are malaise, dry mouth, polyuria, polydyspepsia, nausea, vomiting, shortness of breath, and a fruity breath. Patient education. Know how to handle emergencies by example through instruction. All patients, even children, should know how to contact EMS or 911. Have current certifications in CPR and first aid. Legal and ethical issues. Physician is legally responsible for the care you administer to patients while working in the healthcare facility. No limitations placed on the medical assistant in your state. Adhere to office policies when handling emergencies. Act in the best interest of the patient. So while you are at work and in the medical facility, you are under the physician's license. If you are out in the public and you are not punched in for work and you end up helping someone in the need of first aid or CPR, you are now under the Good Samaritan law and are not, and that protects you as far as legalities in most cases.